Yes, thank you. Good afternoon, ladies and gentlemen. Allow me to share my personal experience being a former migrant worker. I'm Owi Franco, a former migrant worker based in Saudi Arabia. I work as a private waiter and at Jeddah. As a migrant worker, I had no undergo the medical test every time I renew my work permit. I was not aware that they also tested me for HIV. My medical test result was directly given to my employer. The lead assistant of my employer told me that I needed to go back to the hospital. I was accompanied by two co-workers at the hospital. The doctor told me that I was HIV positive. I asked the doctor to give me the result of my test, but she did not give my test result. She just told me that I was lucky because I was brought to a hospital and not to a prison. I was detained in a small room in the hospital for 2 weeks. Migrant workers are vulnerable to HIV infection because we don't have enough information about HIV. Most of us feel homesick, and to cope with this, we have relationship and abroad and engage in protected sex. In some countries, migrant workers forced to have sex with employers get raped and violated. Lastly, because of a cultural and language barrier, were victims of unfair treatment. I felt that my right was violated. I was tested without my knowledge. There was no counseling before and after the test. I was not informed immediately about my status, the result of my test directly to my employer. As a volunteer and a member of support group Filipino living with HIV, I meet a lot of former migrant workers who also experience injustice. In Dubai, 5 Filipino workers were detained for 2 weeks. They were not given any information as to why they were detained. In good thing, there was a Filipino nurse informed them of the situation. An overseas Filipino worker worked in Singapore as a medical staff, was diagnosed with HIV. He was deported back to the Philippines and is now banned from coming back to Singapore. I also meet a former migrant worker from Taiwan. She has been working there for several years. After a routine medical test for renewing her contract, she was asked not to leave the apartment where she has been staying. She was locked inside the room and for several days. Most of the time, a contract of migrant workers are not followed in the other countries. Like me, I signed a contract in our country prior to our departure. I received much lower salary than what is stated in our contract. When the doctor told me my status, I was hysterical. I was not crying because of my status, but because I was not told that I would not be able to work anymore. There was no counseling services in the hospital where I was detained. I had no one to talk to or listen to. While in detention, I was not given a chance to get my things from my place of employment. My employer did not contact me. Migrant workers are terminated due to their status, have no opportunity to get their benefits such as separation fee or health benefits from their employer. While I was detained, I had no access to legal and social support. Female migrant workers are also deported if they get pregnant out of wedlock. The biggest burden of migrant workers when diagnosed with HIV on site is termination from work. My experience was horrific. I would not wish that happen to even to my worst enemy. It took a while for me to get over what happened. I thought I was the only Filipino who is living in the virus. Living in the virus, I did not inform anyone about my status for the being detained again. After I was deported back to my country, I got a job and worked at a mall for 2 years. I ignored my HIV status. I work as if I'm not infected. One day, I got sick and I found an NGO or non-government organization in my hometown. After I talked with them, they referred me to Pinoy Plus Association, a support group of people living with HIV. There I met a spouse of former migrant worker. She gave me a brief orientation on HIV. She was infected by her husband who passed away several years ago. The president of the support group accompanied me to get my confirmatory test. After meeting the support group, I was encouraged to face my status and be empowered. I disclosed my status to my family and faced the media in 2008 in the Philippines. I believe that to avoid what happened to me or to other migrant workers to ever happen again, it would help to ensure that the public authorities are empowered to provide effective prevention and treatment program both in country and across international borders. It is needed to effectuate the human rights to life, health, work, education, and property ownership of persons living with or at risk of HIV and AIDS, disseminate information and education. The inter-country cooperation and partnership should be strengthened to avoid injustice in the receiving country. HIV services in other countries should be also available and accessible to migrant workers. It should be consistent with scientific and public health practices with the human rights framework. I hope that with the stories I shared, you will understand the situation of workers, migrant workers who are detained like me. I would like to call on the government of destination country to remove all the mandatory HIV testing. Being HIV positive does not mean that we should not be detained, that we should not be terminated from work, that we should not be deported. People living with HIV and AIDS are human beings with the same set of rights and responsibilities. We still have the right to work, right to be free from stigma and discrimination. Thank you. That's all.